So you went to the dentist, and the dentist told you have a cavity, but you don't see any holes in your teeth, and your teeth feel fine. You might be wondering, what's going on? Hi everyone, I'm Mark Dawood, DMD. I'm a board-certified pediatric dentist. On my channel, I discuss different topics such as career, education, and healthcare. Subscribe to my channel. And don't forget to smash the thumbs up button below. Welcome to today's episode. Today, we are discussing dental cavities and how to prevent them. The term cavity, when it relates to teeth, most commonly refers to tooth decay, also known as dental caries. It's a very common disease affecting more than 3 million people in the United States per year. It's also preventable, and cavities don't always cause pain. You might be wondering what causes a cavity. Well, first, we all have bacteria in our mouths. These microorganisms serve an important purpose and protect us from other microorganisms that might be harmful to our well-being. The bacteria in our mouth that causes the cavities attaches to the tooth. The bacteria most known for causing cavities are Strep mutans and Lactobacilli species. The bacteria digest carbohydrate-rich foods that contain sugars such as soda, juice, and cake, to name a few. And although these bacteria protect us from other more harmful organisms, upon digesting the sugary foods and the carbohydrate-rich foods, they release acid on the tooth. When that acid is released by the bacteria, it slowly breaks down the enamel, and the enamel is the outer part of the tooth. If the decay or the cavity is in the enamel, fluoride toothpaste and fluoride mouth rinses can help restore that enamel breakdown. If you're still eating a lot of sugary foods and carbohydrates and you don't modify your diet, the enamel breakdown can get worse, and it can get deeper into the tooth, into that inner part of the tooth, requiring intervention by your dentist to further prevent breakdown of the tooth. There are three main factors that are involved in the process of getting a cavity. The first is diet. Fermentable carbohydrates are carbs that can be broken down by bacteria in your mouth. And remember, that bacteria produces acid that breaks down the enamel. What's a fermentable carbohydrate, you might ask? Those are things like sweets, cookies, donuts, cake, candy, bananas, even tropical fruits, dried fruits like raisins, starchy foods like potatoes, bread, and pasta. The stickiness of the carbohydrate, like a candy or a cracker that gets stuck on your tooth or in between your teeth, can be difficult to remove. Therefore, the bacteria is exposed to the carbohydrate for a longer time, which leads to my next point. When drinking or eating carbohydrate-rich products, reducing the amount of time you consume these products helps reduce the risk of getting a cavity. For example, eating a piece of candy quickly is better than having the piece of candy sit in your mouth for a long period of time. And some teeth are more at risk to cavities or dental decay if the enamel has deep grooves or has weakly developed enamel or defects in the enamel. Fluoride exposure helps prevent the breakdown of enamel. Fluoride has been shown to reduce the risk of dental decay. Fluoride is found in toothpaste, and it helps repair or remineralize teeth from acid erosion. It is recommended to use a rice-size amount of fluoridated toothpaste in children under 2 and a pea-size amount in children 3 to 6 years of age. So far, we've discussed that the type of diet and tooth that can make one susceptible to a cavity or tooth decay. The last component is the bacteria. Why is it that some people can have a poor diet and not brush well and still not have a cavity? Bacteria plays a large part. The strength or the harmfulness of the bacteria can vary from person to person when it comes to dental decay. Studies have shown that the bacteria that cause cavities are most likely transmitted from caregiver to child. This is known as vertical transmission. This is why you may see a high incidence of cavities in some families. Studies have shown that the bacteria that cause cavities can be transmitted from child to child. This can happen at daycare or at preschool, and it's known as horizontal transmission. Another major factor that plays an important role in preventing tooth decay is our saliva. Saliva plays a protective role in clearing food out of your mouth, and it also buffers against acid erosion. Some medication can dry out your saliva, and that can decrease your flow rate of saliva, the acid level, and the ability of the saliva to buffer the acid in your mouth. This can increase your risk of getting a cavity. So you might wonder, should I water down juice for my child? Are sports drinks a healthy alternative? Can milk even cause cavities? Remember, you want to limit the exposure time of sugars and carbohydrates. Adding water to juice will only increase the amount of time a tooth is exposed to the sugars in the juice. Limit juice to 4 to 6 ounces per day for kids, preferably during mealtime. Try to avoid sports drinks as most are high in carbohydrates and sugars. Milk, yes, can cause decay, and I'm not saying don't drink milk, but please never have a child sleep with a bottle of milk and brush their teeth after their last feeding. Snacks like crackers can also cause cavities. Here are some tips on good oral health. See your dentist on a regular basis, brush twice daily and floss, limit snacking of high sugary and carbohydrate rich food, drink more water than sports drinks and soda. And don't stress out if you do end up getting a cavity. We all try our best. Your dentist can give you options about treatment. Thanks for watching. Don't forget to subscribe to our channel and smash the thumbs up button.